This is Healthcare Now, radio's trending now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I am, as usual, your host, Shahid Shah. Today, we're thrilled to have Conrad Coopersmith, GM of Coding Automation at AGS Health. And what's trending now? What Conrad and I will discuss is the intersection of AI, automation, analytics, and professional services in medical coding. Medical coding is one of those topics that will seem to never go away. It's one of the hardest things that is in the business to do today, with all the other difficulties that everyone is facing. Conrad's going to be talking about some very, very important topics. So join us as we discuss these and many more trending topics today. Conrad, you've got a ton of experience with almost 25 years of healthcare technology. You've seen the evolution in this medical coding from very, very manual to a little bit of automation, about 5 or 10 years ago, then to additional automation, and now, almost fully tech augmented with AI and other systems. Let's start maybe if this industry is increasingly going to be dominated by AI and automation, what is it about human labor that remains indispensable? Like, there's no way to get rid of human labor in any of this. So tell us a little bit about that. You can introduce yourself a little bit, and then what are the aspects of coding that AI will never be able to replicate in technology?
First and foremost, nice to be here with you, Shahid. Appreciate the opportunity to talk to you about the topics. And as I reflect on your questions, I would actually say they're linked. And what I mean by that is, I don't think about skilled labor versus automation and AI. I think about augmenting skilled human labor with automation and AI. And I think there are very specific use cases that actually fit both. Let me give you a couple as I expand on it. When we think about, what I would call simpler, high volume visits for things like diagnostic imaging or emergency medicine as examples, there's a lot of things that a machine can do faster and arguably more precise code than a person can do, because the nature of those visits are largely consistent and knowable, which presents different opportunities to save time and money, not to mention to save precious resources, which are skilled coders. If you contrast that in more complex areas of medicine like neurology, cardiology, oncology, to name a few, we're going to need a combination of coding automation and people in the loop to be able to render decisions, because there's more information to account for. Not only is there more information to account for, but the rate of change with that information is greater. And that information has to ultimately be contextualized to arrive at final codes in order to bill. And that's taking into account everything from the history of the patient to clinical documentation from the EMR, notes from the physician, orders, labs, diagnostic data from imaging, so on and so forth. In short, the process itself is far more nuanced, requiring the expertise of a skilled coder in conjunction with automation. So whether it's a relatively simple visit or a more complex one, there's opportunity with both to enhance coding outcomes when you marry, a human's judgment with technology. And the irony of that is that ultimately accelerates the capacity for the technology to learn. So when I think about this, I think both people and different aspects of automation are going to exist in tandem for quite some time.
Yeah, I think you're so right about that. And, you and I have about the same amount of experience in this coding world, because I started writing software to do medical coding in the home health business, and then did a bunch of the same things in hospital and other segments. And what I learned is early on, the best coders were almost like, obviously this is silly, but to say almost like pseudo clinicians, right? They knew all the stuff that had to happen in the clinical side, so they knew how to bill properly and in a purely ethical way, upcoding to make sure that the things were captured properly. Then as the coders became less experienced and technology increased, that delta between the human and the clinical knowledge that they need to do proper coding kept growing and growing. And what I'm excited about is over the last 3 or 4 years, especially with generative AI, is that we can start to close that gap again and say coders with the right technology, good human coders with the right technology can become even better human coders because the technology gives them additional clinical as well as the coding connections. Talk about that a little bit. Is what have we been afforded in the last few years with generative AI and the more modern AI systems that maybe we couldn't even dream of 5 or 10 years ago?
Sure. Before I do that, I'd like to maybe talk a little bit about what I consider to be a myth, kind of riffing on what you're underlining now. The biggest myth that I've encountered to date is that AI is going to magically and autonomously replace the profession of medical coding. And it gets to kind of what you're saying right now by moving literally everything directly to billing with no human intervention at all in the coding process, regardless of the visit type or the complexity. And I'd like to publicly kind of reject that as a false premise, because I think all it's really done is create a lot of noise in this industry. And it's doing the technology itself, which has made a lot of gains at this service. So if we start with the premise that medical coding by people is not going to go away, and there are additional opportunities to gain efficiency through automation, and in some cases, based on the actual specialty, to autonomously code charts, which means they are going direct to bill without human intervention. In my mind, we should be focusing on pragmatism. And we should be focusing on pragmatism with all of those scenarios in mind. This is as much about a healthcare organization's mindset and the division of labor as it is about technology itself. So when I think about adoption of medical coding automation, it starts with essentially assessing what the jobs to be done are today and what opportunities can create greater productivity, which will affect the bottom line. And once that has been called out and the work's been segmented and the opportunity has actually been quantified in terms of what people do, what automation does, and then what autonomous technologies can do, there needs to be timeframes established to solve for that. And there needs to be a representation from key stakeholders in solving for it. And what I mean by that is it should be all the key folks, right? The physician community, coding, IT, and revenue cycle. And there has to be support from the C-suite and a willingness to adapt operations in the future with that change in mind. I think the willingness of healthcare leaders to fully reimagine those processes and then to be able to demonstrate patience to achieve an end state, and more importantly, to support the team that's doing it, is as important as the outcomes that can result in the form of savings when it comes to time, money, and resources.
Yeah. What's fascinating about that is I've heard you talk about your term achievable automation, and you're so right that if our senior executives do not classify, like there's human only, and then people talk about automation, and we often see that as binary, but of course there's nothing binary about it. And achievable automation is a good way to establish this and say, well, why can't we automate this? Because you say it's not achievable automation. Describe that term a little bit more, and how can senior leaders use that term to help quantify what is the art of the possible and achievable versus why are we even talking about this? Because we're still many, many years away from full 100% no human automation, no human needed in the automation process.
Yeah, it starts with defining the actual use case. And like we talked about earlier, I think there are several where people are going to fit using some form of automation. And automation may exist solely, again, based on the complexity and the type of the visit. But in my mind, it starts with defining that use case in order to quantify if the problem's even worth solving. Mm-hmm. A lot of times people usually take a ready, fire, aim approach to problems versus the opposite. So it's easy to get ahead of ourselves, and that can present challenges when we do.
Yeah, that's great advice. And as you start to think about how people should start to quantify this and categorize, could it be something as simple as a low, medium, high work visit. Like, for example, if the visit took 15 minutes versus 45, the 45-minute visit might take much longer to do coding and may need additional human intervention rather than the 15-minute visit. So it sounds like you're talking about being able to classify these kind of visits. Is there some heuristic that you guys have come up with at AGH that might assist there?
Sure. And it's based on the fact that part of our core business is delivering medical coding services as well, which is something that we're steeped in. It's in the DNA of the company. So it's not just about technology. It's probably more so about understanding the operational impact of what you're trying to solve for. What I would also share is that we've all been a part of automation projects. If you've been doing this for more than a day, that have not gone well. And when we think about that, there are pretty simple reasons for it. When it doesn't go well, usually folks don't think through the desired outcomes in advance. They don't involve the appropriate stakeholders that are integral to the process. And there is dependencies on those stakeholders when it comes to data. And none of that gets memorialized at the initiation of the project itself by the executive sponsor and revisited on a regular basis to see if they're actually getting the outcomes. So drawing on several learnings over years, I would categorize two factors that lead to challenges with implementing automation. And I would say it's as simple, Shahid, as people and data. And when we think about people, again, there's often a lack of awareness as to who should be involved with a project, the role they're going to play. And in the use case of coding automation, it should be coders themselves, representation from physicians and clinicians, IT revenue cycle, and all those parties really do play a role. And if you peel it back another layer and you think about it for a minute, physicians and clinicians are on the front lines of care delivery, which manifests itself in services rendered. IT is the group that enables the delivery of data for coding. And it's coming from a myriad of sources, including EMRs and other systems housing documents and diagnostic data like we talked about. Coders have the role of bringing all that information together, putting relevancy to it, and making sure that in this context, patients don't actually overpay for care and providers aren't underpaid for the care. And finally, revenue cycle is responsible for dropping the bill, making sure it's paid. So that's the people side of it. And on the data side of it, I mean, it's key to make sure that all systems are accounting for in terms of where the information is coming from, that interfaces are mapped and technical dependencies are clarified. Because when the flow of data for coding and the disposition of that data for billing is not understood, that's when it tends to lead to downstream workarounds. And usually what that means is time, money, and resources, or worse yet, revenue loss, which defeats the purpose of putting in automation in the first place.
Yeah, that makes a lot of sense. And so if you are just tuning in, you're listening to Healthcare Now Radio. This is Trending Now. I'm Shahid Shah, and I'm talking to Conrad Coopersmith at AGS Health. And we're discussing this fascinating topic of the intersection of AI, automation, professional services in medical coding. And what Conrad has taught us in the last 15, 20 minutes as we've been chatting is that lots of people have myths associated with how much automation is possible. So we should focus on achievable automation, not trying to pull all humans out of all loops and hope that medical coding will get done magically in some easy way with new AI. There's a ton of hype. The good news is that a lot of the hype around AI is finally starting to settle a little bit. And what we recognize is every executive's push to AI might give us this one nice impetus to clean up our data. So Conrad was just teaching us how people and data are the two cornerstones of the success you might see in medical coding automation. On the data side, we have always heard of, garbage in, garbage out. If you have bad data, you're going to get bad outcomes on your automation. But it's even worse now with AI, because if you use generative AI with bad data, you don't just get a little bit bad data out, you get a ton of hallucination, a lot of other bad data out. So maybe tell us a little bit about what's a good way to use this AI push from executives, Conrad, to get our data house in order, as it were.
Well, it starts with an assessment, just simply put, of where the data is coming from and what it looks like. And as you know, there are lots of different types of data. There's structured data and unstructured data, all of which flows into a model, whether it's coding automation using some natural language processing and computational linguistics and all the other good stuff that goes into building AI models, or it's full-blown, artificial intelligence itself. So it starts more by inventorying processes and systems, and then making sure that data can be delivered in a way that's repeatable and consistent.
Yep. And how much does AGS help in that inventorying and other processes, or do you assume that that's already been done before you walk in?
I would say we're part of it on the front end, and we're also part of it during the delivery phase, helping our provider partners kind of think through where it should be coming from, and then ultimately what it's going to be looking like based on what they're trying to solve for. So both.
And a lot of customers already have their existing technology. So let's talk about the technology vendors in this case. So one partner, of course, is your customer themselves, but you have a lot of technology partners. In your experience, what are the key qualities that healthcare leaders, maybe at your customers or others, should be looking for in the technology partners? Do you usually walk in and say, okay, whatever tech you have, we'll use it to gather data and do the work on top of that? Or do you look to help the customer replace any technology vendors? So just red flags, warnings from certain kind of vendors. Who should you be staying away from, basically?
Sure. I mean, in deference to technology in general, like anything else, and as we've talked, I would begin with the end in mind by defining what the organization is trying to accomplish, fix, or avoid by going through a process to begin with. And once there's an actual tangible use case identified, again, I would focus on involving the right people and convening a small team to conduct research, on new technology. And as an organization starts to diligence partners, and we help organizations with this quite a bit, what I would pay attention to is the technology partners' time in the market, what they believe they are really good at in terms of core competencies, their track record of delivering those things, and the specific knowledge of the business problem, in this case, coding, that the organization is trying to solve for. And I would be looking for actual outcomes from current customers. The other thing that I would say is I would test the partner's knowledge of coding to understand if they understand what has to happen operationally to take advantage of the tech. Because there's a lot of companies that look at problems and opportunities through a technology-only lens, and that oftentimes does not comport to reality. So if they speak in absolute statements, if they use 3-letter acronyms and paragraphs, if they can't provide proof of results, I would say you have good reasons to be skeptical, and I would push on that.
Yeah, I totally agree with that. And as a software engineer, I resemble that remark where I talk tech and just assume that, hey, if I write this code, all will be well. And of course, without the people and the data, nothing is ever well with just adding more software. Given that that's the case, there might be senior executives and others that already have teams of billers at the moment. They have medical coding professionals. What are the kinds of problems that you're hearing where people are like, well, can I get rid of half my coders? Can I reduce the total staff? Or do I not need to hire any more billing and coding people? You started to answer that in your earlier remarks, which is this automation is not going to 100% replace humans. But is it replacing 20%, 90%? What do you see in that marketplace?
Yeah, so I would tell you, based on real world experience, I haven't met a provider customer in the last 5 to 10 years that's looking for less people. They're actually looking for more people, and they're looking to do more with less. because that's the reality of the situation that we're in. We're not creating more medical coders. In fact, they're retiring and leaving the profession in many cases because of the age, right? So they got to figure out how to do more with less. So I would say it's more about the division of labor, segmenting the work, and redefining what the job is that they're doing today. What we're seeing in the market is we're seeing through automation, traditional coders focus on items like audit and review, and those jobs changing over time. We're also seeing healthcare organizations invest in educational tracks that are more related to programming, math, and statistics in the discipline of medical coding, because they're able to better use coding automation and AI and appreciate the data that results from it. So I would say the jobs are changing. I don't necessarily think that people need less people. They just need to figure out how to channel them a different way.
That's right. So as we think about this, and if there are any medical coders which are listening in the audience now, there is no danger of medical coders in large numbers losing their job because medical coding will be all automated. Now, there are places where medical coders or folks who are not growing in their skill sets, meaning improving their auditing, improving their reviews, getting closer to the clinical side that AI affords, that is a little dangerous, right? So what would you suggest to medical coders to remain at the forefront of their profession, as it were, so that this technology and this automation, which is not creating any grave dangers for them, but they could potentially be staffed out of a job by other people who have those particular skills. So what are your recommendations to billers themselves?
Sure. So we've discussed medical coding is going to require a person in the loop for the foreseeable future, especially with more complex specialties in mind. As things become more automated, and they will, we see the role of the traditional coder changing again to more of an auditor, right? Providing final review and sign off prior to chart adjudication and billing. And knowing that that shift is happening now, I would encourage folks, again, to invest in career paths that incorporate base understandings of AI and automation so they can better appreciate the output of it. What I would also say, pragmatically speaking, is knowing what to do is different than knowing how to do it. So the reason I say that is, in my experience, the best way to prepare a team to handle complex and different tasks when jobs inevitably change over time is to pick an actual use case, implement it in your organization, and iterate on it. In this context, it could mean cross-training existing coders on audit functions and then using automation to help facilitate that.
Yeah. That makes a ton of sense. So do you have any specific examples? Like, for example, if you are opening a service line in which you're increasing the amount of services that you want to provide in, let's say, in heart care, cardiology, or in oncology, what would you recommend leaders do, just as in a simple use case example that you were giving?
I would recommend going to a non-competitive environment, visiting that environment, looking at their existing service line from soup to nuts in terms of a person being admitted, a person actually receiving those services, coding for those services, and billing for those services. And I would recommend the executive team actually go through those functions to be able to internalize what that might mean to their own organization. And then as they take that back and they think through that, use it as a live lab.
Yeah. And so in that case, what I love that advice is that it is the senior executives, not the middle staff, that are going out and learning about this, because the senior executives are the ones that are supposed to be focused on revenue, new service lines, et cetera. And that advice that Conrad just gave is fantastic, because if you can go out to a non-competitive environment, do two things, which is understand whether you should actually be improving or starting or augmenting your service line. That's the actual use case, not the technology part. And then say, okay, if we're looking to drive revenue or increase our scores in certain areas, based on that, then you can say, all right, how would we refactor some of our staffing, et cetera? When you start to think about that, what's really nice is if we were talking about pre-pandemic, let's say 5 years ago, before any of the generative AI and the more modern AI came in, we would be trying to figure out some small incremental steps and see how things go, because technology was not moving in huge steps in terms of improving productivity at the biller or the clinician, et cetera. However, we now have an opportunity. There's still a ton of hype, but there is an opportunity here to be able, and Conrad helped take us through the next couple of minutes as we wind down the interview today, is what does the future look like with some, take some wild swings and say, look, in the next couple of years, here are some big things you can do if you put in the right technology and make that happen. So think a little bit visionary, Conrad, and talk to us for a couple of minutes about where you see this technology going to let you do the big things we couldn't even imagine a few years ago.
We've been talking about the Affordable Healthcare Act since 2013, roughly, right? Which is hard to believe. It's over 11 years ago. And I was just talking before we got on about the fact that we tend to go through 10-year cycles of things. That whole act or the underlying premise of it, in addition to making healthcare more affordable for Americans, was to set the stage for value-based contracting. And as value-based contracting continues kind of that evolution towards reimbursement for outcomes and quality, and computing accelerates, I think we're going to see additional opportunities for coding automation in more complex medical specialties, and we're also going to see it in non-traditional care settings. And core to that acceleration and the expansion of technology will be access to data from non-traditional data sources. And I'm talking about things like telehealth as one example, and ambient voice recognition as another. In my view, there's going to be very few companies that are able to harness data from new sources, to code that data, to tie it to billing operations, and to maintain flexibility to accommodate a division of labor, which is going to continue to require people performing medical coding, use of coding automation, and true autonomous technology. So in my view, I think those new tranches of data are going to be a unique opportunity, and there's going to be very few companies that are going to be able to take advantage of that. And as a result of that, I think we're going to see, again, tremendous consolidation across revenue cycle coding and the whole continuum of the process itself.
No, it sounds like a great visionary view. So, Conrad, thank you so much for your insightful perspectives on this very evolving role of automation in medical coding and balancing technology with skilled labor where it's absolutely necessary. And to our listeners, thank you so much for joining us on Trending Now on Healthcare Now Radio. For this engaging discussion, stay tuned for more episodes where we explore the latest trends and innovations shaping healthcare's future. Thank you so much.